Project A, Parkinson's disease in medical terminology. Parkinson's disease is a progressive chronic motoric neurodegenerative disorder that exhibits a broad spectrum of non-motor and motor features. Onset of symptoms generally occurs around the age of 60, although early onset can begin around 50 or younger. There's a gender bias with PD, which usually means it affects more men than women. PD is caused by the degeneration of dopaminergic neurons in the basal ganglia, specifically the substantia nigra. A lack of these neurons triggers a torrent of functional changes that affects the entire basal ganglia circuitry. The brain cells of individuals with PD have Lewy bodies. This encephalopathy is characterized by 4 cardinal features that are umbrellaed under the acronym TRAP: tremors at rest, rigidity, akinesia or bradykinesia, and postural instability. Parkinsonian tremors or dyskinesias are involuntary movements that can be erratic or rhythmic, occurring mostly in the distal portions of the upper extremities. Tremors are unilateral to begin with and progress to be bilateral. Rigidity is increased spasticity of the body, which causes postural deformities. Camptocormia is an uncontrollable forward truncal flexion of the spine, which can be seen when walking or standing in patients with Parkinson's and subsides in the supine position. Bradykinesia is the trademark symptom of basal ganglia disorders and can cause hypophonic dysarthria. Postural instability is the failure to sustain equilibrium during static or dynamic conditions like preparation for movement or quiet stance, which could lead to accidental falls. Other aspects of Parkinson's include lethargy, orthostatic hypotension, which is caused by a decrease in norepinephrine, gastroparesis, blood pressure irregularities, hallucinations, dysphagia, hypomemia, salaria, sphincter dysfunction, erectile dysfunction, laryngeal dysfunction, urinary incontinence, obstructed defecation, ataxia, seborrheic dermatitis, and Lewy body dementia. And non-motor symptoms of PD include clinical depression, clinical anxiety, apathy, REM sleep disorders, and cognitive impairments. So this is Project A, Parkinson's disease in lay terminology. Parkinson's disease is a disorder of the brain that causes involuntary movements like shaking and stiffness and complications with coordination and balance. Symptoms of Parkinson's get worse with the passage of time. Anyone can be diagnosed with this disease, although it tends to affect more men than women. Parkinson's disease is an age-related disorder and changes in a person's mobility or posture shown around the age of 60. And if it's before that, it's considered early onset. Neurons in the basal ganglia produce dopamine. The death or impairment of these neurons ceases the production of dopamine, which leads to mobility issues. The main chemical messenger of the sympathetic nervous system, which is norepinephrine, is also lost with the onset of PD, which attributes to more non-movement aspects of Parkinson's. The 4 primary symptoms are tremors, which are specifically seen in the arms and hands, but they can also be seen in the legs and the jaw, slowness of movement, or developing a Parkinsonian gait, muscle stiffness, which means that they remain contracted for long periods of time, and impaired balance and coordination, which could potentially lead to falls. Symptoms start on one side of the body or a limb and ultimately affect both sides. And friends and family are usually the first to notice these symptoms in people with Parkinson's disease. Other aspects of Parkinson's include fatigue, irregular blood pressure, decreased movement of food through the GI tract, sudden drop in blood pressure when a person goes from sitting to standing, emotional changes, difficulty swallowing and chewing and speaking, urinary and constipation problems, and skin problems. The majority of people with Parkinson's disease experience reversal in cognitive function, like problems with memory, attention, planning, and accomplishing tasks, and this is usually considered Parkinson's dementia, which is a type of Lewy body dementia.